This is Neil Osterweil at the American Society of Hematology annual meeting, where Dr. Jorge Cortez just presented data on Ponatinib, a new tyrosine kinase inhibitor that has the ability to overcome resistance mutations seen with other agents.
We've seen that at least the common mutations, the ones that we see regularly in the patients, it has activity against all of them. That's in the laboratory. And what we saw in the study is that indeed the patients that had all sorts of different mutations, we saw responses in all of them. Of course, not everybody responds, not every patient responds, but we did see responses in patients that had any of these mutations. So that tells us that this is perhaps a broader spectrum of a drug compared to some of the other ones that we have. They're already very good, but this one seems to be a little bit more comprehensive in its reach.
Do you think with longer experience with this agent that you might see emerging resistance?
I think that most likely that we will see emerging resistance. Actually, clinically, you see an occasional patient who develops resistance. The duration of responses has been incredibly good. But there's been an occasional patient who loses a response. So I think we will see that. I think we probably, it'll be naive to think that it's not going to happen. What I think is going to happen is that the emergence of resistance is going to be much lower than we see with the other drugs. That it's going to be a lot more difficult for the cells to develop resistance to a drug like Ponatinib.
And are we going to be seeing more use of this drug in combination with other agents?
I think there's a lot of interest. There's already some studies that are emerging that are combining it. For example, in Philadelphia positive acute lymphoblastic leukemia, we're combining it with a regular chemotherapy, and that's an approach that's been successful with other drugs. And I think these being more potent and more a better drug for all these mutations, I expect that it will give us better results.